Hi, everybody. Hi, Mary. Hi, Nathan. Hi, Richard.
Hi, Naomi. Hi, everyone.
Everyone.
You're looking nice and warm in your bobble hat, Nathan.
Thank you. Yeah, no,
I
keep on turning up the heating and it doesn't seem to work, so I'm just layering.
Good
That
plan.
one you made yourself, Nathan?
Pardon?
Is that one you made yourself?
Yeah, it's don't know if you can see, but it's a bit too long, so I'm just kind of hiding it behind the camera. But, yeah.
I like the colours.
Yeah, I was trying to go for Proud to Care colours, but yeah, it's just
That's true commitment.
Yeah.
It's significant commitment.
Yes.
So, we'll give people a minute or two, I think. I can see Joe's here, who's presenting on urgent care. Who are you presenting with, Joe? And
I'm presenting with my colleague Orhan, who's also here.
Great.
Patrick, unfortunately, was unable to make the meeting today.
Okay, great. And good to meet you, Orhan. We'll give people another minute or two, just so a few more people will arrive, I'm sure.
We had 38 accepted, whether that stays true, but there should be a few more hopefully. And I sent another email on Tuesday, I think it was.
Great.
I can't remember.
And I'm chairing today as Bindi couldn't make this session. And we're going to cover, I'll say who I may as well say who I am. I'm Richard Taylor-Alfig, Programme Director for North London Council's joint areas of work. So we work across Barnet, Camden, Enfield, Haringey and Islington. So great to have people with us. We're covering today urgent care plans, updates around workforce projects, and a little bit on cost of living guidance. We've kind of kept it quite a short agenda, so if there's anything people wanted to cover, we kind of thought it was too late to do a kind of general winter planning session. And we know there's lots of that has happened locally within boroughs, but if there are areas where providers have questions or things you'd like us to cover, do also put that in the chat. And now, kind of 3 minutes past, I suggest that I hand over to Joe and Orhan to say who you are and take your item. So welcome.
Great, thank you very much. So I think I've got some slides that we're going to share, so we'll get those up. But I will also just introduce who I am. So I'm Jo Broomfield. I'm a project manager currently supporting North Central London to engage with care providers on the London Urgent Care Plan. And I'll just hand over to my colleague Orhan to also introduce himself.
Thanks, Joe. I'm Orhan, colleague of Joe's, and I specialise in comms, so I'm supporting the comms and engagement with the London Urgent Care Plan. So thank you for having us. And Nathan, thank you for sending some of our files out via Proud to Care routes.
Thanks. So we'll just move on to the next slide. So this is just a very short slide deck just to provide a kind of introduction to the London Urgent Care Plan. So this is a new NHS service that allows every Londoner to have their care and support wishes digitally shared with health and care professionals across the capital. So it's specifically around urgent care. And it provides a single care plan for each resident or patient that's accessible to health and care professionals across the capital, allowing their wishes and needs to be followed in the event of an urgent care scenario. And it's replacing the tool Coordinate My Care, which was used previously, if people are aware of that. So just on the right there is kind of a screenshot of the tool, and we are coming today to try and encourage all care providers to sign up to the tool to start having visibility of the urgent care plan for their residents and patients. So next slide. So just to recap some of the benefits of the urgent care plan. So it ensures that there's a single shared urgent care plan for each resident or patient that's visible by health and care services, with the idea to ensure seamless care because everyone's looking at the same information. It also allows residents and patients' wishes to be documented and therefore taken into consideration when care is provided. And as it's a digital tool, it can't be lost and will follow the patient everywhere they go. And then finally, in comparison to Coordinate My Care, the urgent care plan has lots of new features which make it much easier to use. These include kind of publishing the plans and amending sections for individuals without higher approval, viewing and edit history, and also having the ability to print the full plan or individual sections. So I'll just now hand over to my colleague Orhan, who will take through how to sign up for the urgent care plan.
Thanks, Joe. I'll just go on to the next slide. Brilliant. So there are a series of requirements that care providers will need to meet before you register. The first of which being that care providers need to be DSPT compliant at standards met. If you're DSPT compliant, the next thing is regarding your email address. So organisations' email address should end with nhs.net, nhs.uk or .gov. Although having said that, if you don't have one of those email addresses, it's not the end of the world. You can still get access. It just requires an extra step. So the urgent care plan team will just assess those on a case-by-case basis. So assuming you pass all those requirements, the registration process is fairly straightforward. The first step being you need to complete effectively what's a request form. So we've got a link here. Naomi, if it's okay, we can share these slides around just so everyone has access to the links and other bits and bobs. So yeah, the first step is just to complete a form. It only takes around 5 minutes or so. It's just about the name of your organisation, where you're based, whether you're a part of the previous care plan system, as Joe mentioned, which was CMC. And once that's submitted, NCL ICS complete the relevant IG protocols, and they'll add your organisations to the DPIA, the Data Protection Impact Assessment. As part of that, you will need to sign a deed, which again is also attached to this slide deck. So you can see an example of what that deed looks like. It's just regarding data processing. And then once you've done all that, so you get sent a link by the UCP team, and then you can go ahead and just sign in. So it's, yeah, there are a few steps which make it seem quite, verbose, but it's actually quite straightforward. So once you've signed up, in terms of how the UCP actually works, so much like other care plans, a doctor or nurse will create a plan following a conversation with their patient. So it'll be about their preferences, how they wish to be cared for, what kind of support they need, who they feel is best placed to provide that support. And they'll also provide a doctor or nurse with any information about if they want any of their relatives or friends to be involved in that process or involved in their care. So once that information is saved on the plan, it then becomes visible to health and care services who use it. So that includes people like LAS, care homes, 111, and out of homes GP services who may see the patient in an emergency. So in terms of you as care homes, how you can access and use the plan, in the first instance, as it's just being rolled out, it will be view only for both clinical and non-clinical roles. But by early 2023, we expect that everyone will be able to edit. The extent to which you can edit depends on your role. So if you work as a clinical role, you'll be able to edit, as it says here, things like medications, medical history, prognosis, emergency care, symptom management forms. And if you work in a non-clinical role, it will change slightly. So you'll be able to save and publish things like personal information, advanced decisions and alerts. So that's a whistle-stop tour of how it works. This is an example of the data processing deed. I won't open it now, but as I say, ideally we'll send these around to everyone and you can have a look at what that form looks like. And just finally, so we are providing short system training videos if there's any element of the care plan you'd want to know a bit more about, and they'll be linked here so you can click through and view those in your own time. Although if you're finding trouble with a particular part of the urgent care plan, you can also request sort of more bespoke and extended training videos, and the email to request those are there. So Joe and I are supporting NCL ICB in trying to roll this out as far as possible. And NCL ICB are providing dedicated support. And as part of that, if you need any more information to find out about any upcoming training sessions, I've left Patrick unfortunately couldn't attend today, and Joe's email address. And we're also looking into the possibility of doing sort of more one-to-one training sessions with colleagues. So if you have a go at it and you feel like you need a bit more support, then do reach out to us and we'll try and facilitate something with you. And I think that's probably it, unless I've missed anything, Joe.
No, I'd say that's everything. We are very keen to get as many care providers signed up to the urgent care plan as possible, because we do believe it will be beneficial for the care of residents and patients. So please do reach out to me if you need any support. As Orhan said, my email address is on the slides. But yeah, happy to answer any questions.
Thank you. And I think, Nathan, you may have uploaded the FAQs to the Proud to Care e-portal, but we'll send them around to everyone as well. So if there's any questions, ideally they'll be answered on the FAQs, but if not, as Joe says, you can contact either Joe, myself, or Patrick. That's it. Thank you.
Great. Thanks. Thanks, Joe and Orhan, and thanks also for confirming in the chat, Joe, that if providers want to access an NHS mail, which is an enabler for this, we can kind of support you, or the team can support you to do that. So I'll open it up to questions. I guess there's a question about sign up. I suppose there's also people might want to comment on your experience of kind of Coordinate My Care and urgent care planning with residents in general as well. So please do also do that. Do people have any questions?
No.
So people might think I'll come in with one initially, but do kind of come in, or even put it in the chat if you don't want to speak. Yeah, one question I had is kind of is there views on whether we'd expect urgent care plans to be used with all social care providers? So I know there's a big focus previously on care homes, but is it something you'd expect dom care to be using regularly as well? Is there any differences in how it's used in different settings?
So I don't think there are any differences in how it's used, and we would encourage all care providers to sign up for it. There are the requirements of being DSPT compliant and having, it's easier if you have those specific email address endings that were listed on the slides. But if, other care providers outside of care homes have those requirements, then we'd definitely encourage them to register as well, and it will be used in the same way.
Great. Thanks, Joe. And Marnie, do you have a question?
Yes, hi. What happens to care homes who will have changes of medications, like consultant psychiatrists or GPs? How are we able to change it in the urgent care plan if we don't have access to change?
So in the first instance, care providers will be given read only, but we are hoping that this will be changed to read and amend in early 2023. But if there are changes that are required in the urgent care plan right from the beginning, we would ask care providers to work with their GPs, because the GPs will have the ability to edit the urgent care plans.
Okay, thank you.
Any other questions people have? Or anyone want to share your experience with either Coordinate My Care as the previous version of this, or the urgent care plans if you're already using them? Naomi?
Yeah, I just had a quick question about them, because I've never really come across urgent care plans before. Are they similar to sort of end of life plans? Is that what they're designed to be used for?
Yes, I believe so. So
Okay.
Patrick is actually the end of life commissioner in North Central
Awesome.
London, who's trying to facilitate this rollout. So
Okay.
yeah, I think it's the same.
Right, thank you.
So they build on the successor, aren't they, to Coordinate My Care? Is
Yes.
that right?
That's right.
And I think the intention is maybe they're a little bit broader, but yeah, with still a strong end of life focus. mean, I guess areas providers have fed back before have included things like sometimes that they're not that maybe people coming in ambulances haven't always seen them. So there have been particular issues where somebody's preference might be to die in the care home, you know, with the right support around them to die well as according to their wishes, and that hasn't always happened. So that's partly why I was kind of asking for people's experience. And there's a question in the chat. So a question about kind of how they cater for people suffering from or living with dementia. Do you have a response on that one?
So I don't actually have a response about people suffering from dementia. I'm sure there are checks about getting it signed off by an appropriate person that's responsible on their behalf. But in terms of the ambulance service, I do know in terms of the London Urgent Care Plan, there is a big push to get ambulance services signed up to this as well. So there's a range of different videos about using it, and one is specifically with the LAS. So I think hopefully that, well, was at least identified as one of the challenge. And Miri, I also your question, we have created a simple FAQ crib sheet. So that was hopefully circulated to all care providers by the local borough leads, and Nathan has also uploaded it to Proud to Care, but we can circulate the documents with these slides as well after this meeting. Or Naomi, I think we'll send them through to you if that's all right, and you can circulate them. Great. Thank you.
That's fine.
And Adrienne, do you want to? How was the sign up process for you? Or you mentioned you sort of signed up, started to use it.
I think it was fine actually. So it was obviously it was the operations manager in a way that's managing it across the 3 homes. I think in the past it was difficult because of just the logistics of just getting the NHS kind of email address and things like that. So I know that was difficult in the past, but I guess the interesting question, so I was saying, sorry, living with dementia, isn't it? But I also go to a kind of support group that we still run, and people still talk about very, very confusing experiences of coming into hospitals with dementia and losing all sorts of care plans and being told to print them out 5 times and things like that. And then they get lost between different, even from you going from a acute to admissions to the next, it all gets lost really. But hopefully this is going to solve this in the long term, isn't it, as well? So I think experience at the moment, once we got over the sort of NHS email hurdle, has been kind of better really as well. But it was interesting talking about the differentiation between who can edit and who can't, because I guess even though we're residential homes, and even though we might have some qualified nurses, I think we'd probably be classified as non-clinical, so we would only be allowed to do certain other issues. But that was just something in my head when I was looking at your definitions of it.
Yeah,
great. And I mean, Joe or Han, do you know if that's the case on the kind of nurses working in residential homes? Because it's not uncommon for a nurse to be there, but they're not classed as nursing homes.
I think it most likely will be the case. This is, the definitions are not set by our, the variants is not set by us, but set by the London Urgent Care Plan. It's something we can take away and check about specifically nurses working in residential care homes, but I suspect it'd probably be done on a care home level.
Because it was a very good point actually that I think Miriam was raising about, you know, because you might have a situation where someone's been seen by the GP or by a specialist service like a psychiatrist or something like that, and of course unless they're updating it quickly, there could be an issue then where there's a gap where the home will know, because hopefully they have been informed, but it's sort of in our CMS, our electronic system. But if we can't then enter it, I think it could potentially cause a delay, but hopefully, I suppose eventually it won't, because they'll all be doing it in an online format. But it just worries me a bit. So I did think, Mary's question was quite a good question as well.
Yeah, I think that was also one of the concerns from Coordinate My Care, which is definitely something that's been trying to be addressed, and why we want to give edit rights to kind of clinical staff in care homes moving forwards. It's not possible right now, but I can also pick up that about clinical staff in residential care homes. But in the short term, it would be to work with the GPs to make sure it's updated as quickly as possible.
It's probably worth saying as well that if there are any other worries, or if you do sign up and you find something that's a bit of a niggle, to let Joe and I know. Because I know when CMC was stopped in March 23, the idea was that this would be a sort of, like you said, Richard, a kind of new and improved and expanded version. And I think the team went through quite a lot of engagement, but without, you know, people using it, there's only so much engagement you can get. So I think the UCP team will be quite keen to hear people's experience and look into ways in which they can iterate to make it better. So yeah, as Joe's already said, do let us know and we'll pass it on, and we can get back to people with any updates or changes that makes everyone's lives a bit easier.
Great, thanks, Orhan. And I guess one of the possible options might be that people can edit, but then it gets approved by a clinician.
Yeah.
Because I think one of the challenges care providers would face is actually getting through to the GP and then being able to respond, you know, in a timely way. It just, you know, it might not always be possible. So I did think of one more question, was in terms of the sign-up process. Is there a sort of, so care providers are signing up to see existing UCPs. Is there a process underway to create a lot of UCPs?
So I think there's a push to create UCPs. I think this is sitting mainly with GPs for now. I would say I do know that there's a project going on with Marie Curie, and I think it's in Islington and Camden, to create UCPs for residents, I think across care homes, which we either has started or will start in January. But there is a drive across the whole of London to really start creating London urgent care plans for residents. Okay.
So it'd be useful to know that as well, because I think that also would help incentivize people to sign up. And I'm assuming they'd focus on care home residents in particular, but people receiving long-term care generally, because they're obviously, as the older people's cohort, obviously closer to end of life. That might help just people understand where it is in their area. Great. Any other questions anybody has? Or otherwise, we'll thank Joe and Orhan and go to the next item. Okay. So I'm not seeing any hands. So thank you. That was really helpful, and I think it would be worth kind of working with Naomi and others about kind of progress, and if there's anything, you know, if we want to do some kind of quality checking with care providers, thinking about how we do that, because yeah, we'd really like to see these being used widely, because we know they really help people to die in the way that they want and have a kind of personalized approach. So really support everything you're doing.
Great, yeah, that sounds great. Very happy to work with you, Naomi. We will dial off now, but just please do, all care providers, reach out to me if you have any further questions or want support. I am not taking any holiday over Christmas, so I'm around. And yes, thank you very much for your time.
Thank you both.
Take care. See you later.
Great. So next item on the agenda is workforce presentation. Naomi, this is you.
Can you see that?
Yeah, that's up.
Great, thank you, Richard. So I wanted to bring a bit of an update around some of the workforce items that we're currently looking at in NCL. So just to give you an overview of what I'm going to discuss. So I'm going to talk about the Health and Social Care Academy, Proud to Care North London, international recruitment, student placements, and then Ron Care is going to do a bit of an update on the work she's been doing on secondment from the Prince's Trust. So firstly, the Academy. Sorry, just briefly, as you can see, I've put the different logos of all of the boroughs on here, as well as Proud to Care North London. And also just to highlight that our training hub colleagues are also going to be integrated with this model. So we're bringing in elements of primary care, as well as secondary care. So that will form the health aspect of the academy, and then social care as well. So a bit of the background to the academy. So the integrated care system in an NCL has a priority to develop the employment pathways that we have, which support local residents, particularly those with barriers to work, and in order to get them into roles within health and social care. So the work is mainly being carried out by economic development teams who sit within each of the local authorities, as well as all the innovative recruitment which has been developed by the NHS, social care providers, North London Council's programme team, and the training hub. So back in the summer, the GLA announced funding for a health academy, and the bid was led by Islington Council. The funding has since been awarded, but the GLA then later announced that there would be funding available for a social care academy as well. So what we've done is we've put in an integrated bid for a health and social care academy. So we want this to be truly integrated across the sector. And just to say that we are still waiting formal agreement on the success, hopefully, of our bid from the GLA, but this should be due hopefully this week, if not next week. And the purpose of the academy, so it's really to improve the coordination of the resources that we already have in place in North Central London and develop a stronger shared purpose between the training providers, our health and social care employers, and also the pre-employment services that we have currently through our economic development teams. So what we want to achieve is a pipeline of residents who are work ready following successful completion of a course delivered by one of our training providers. So at the moment, this is mainly the care certificate, although there's also different options such as level 2 and level 3 health and social care courses. So what we want to then do once they've completed their course is to offer our residents a guaranteed interview in a setting of their choice, and preferably within a commutable location as well. The funding that the GLA have proposed is 250,000 for each academy, and that will be for approximately 2.5 years. So after this point, we would like to be able to create a sustainable academy for the future so that we can support our workforce needs. And just briefly to let you know about the objectives that we have. So we're really aiming to identify and support residents who have barriers into work, and enable them to access entry-level roles which are paying London living wage within both health and social care. We also, as part of this work, are really keen to support people's ability to progress as well within their chosen career. And we want to have a pipeline of people who we can sort of enable to reach their full potential. And just to mention on this point as well, our colleagues at the Training Hub are currently developing a career pathway tool, which will really highlight how people can progress once they're maybe in a role, what the different options are in terms of what they can study, and it will really help people to further understand the sector. So some of the measures that we've put in place. So we've given ourselves a goal of having 165 health and social care employers engaged in our activities with the academy. So this will be a really wide range of employers. So we'll have different sizes. It will include primary and secondary care trusts, the voluntary sector, care homes, domiciliary care, and also specialist settings such as mental health and learning disability. Our target for engagement of residents in training within this sector is 1,650. And this will come from a variety of settings such as Capital City College Group, Barnet and Southgate. We also have an online training provider called Learning Curve. And we also, in addition, have our adult community learning teams and our economic development teams who are already in place and look at developing pathways to employment. And then the total for residents moving into good work within the health and social care sector, we've put as 880. So this is our sort of target goal. And I'm sure that people have already come across our economic development teams. So we have like Good Work Camden and Haringey Works, for example. So we want people to be in roles with good terms and conditions, fair pay, and obviously access to training and development as well. For some reason, there we go. So I just very briefly wanted to give you an overview of our proposed resident journey. So the first thing that we will be doing will be trying to engage with the residents across North Central London. We'll be using a variety of different marketing strategies in order to access people and enable them to then register through, register into the health and social care courses, potentially the care certificate, with our further education providers. At this point, once they've successfully completed the course, the hope is to then match them into employment in either health or social care. And we've also recognised that some people may go directly into employment. So it might be that we can look to enable them to do some training, perhaps whilst they're waiting for their DBS check. So yeah, it'd be good to get some feedback on whether people already do that at the moment and how that works. And then the next step will be looking at the in-work support. So working with providers to see what's already been done in terms of induction and possibly buddying as well, and what's already in place to support people with retention. And then we also want to focus, as I mentioned earlier, on the progression opportunities that are available. And just briefly, the delivery model. So we're hoping to create a model which will use a hub and spoke. So the hub will be North Central London and the spokes will be each of the individual boroughs. So the majority of delivery will be led by borough-based work, because we recognise that each borough is very different, and also there are a lot of existing services already in place. Our colleagues in Islington have already got a health and care academy, so we're very fortunate to be working closely with them and hoping to replicate the work that they're already doing within the other 4 boroughs. And the reporting will be done most likely by the programme coordinator, and we are in the process at the moment of formalising the agreed governance structure as well for the academy. So the staffing will be made up of a programme coordinator. We'll then have an administrator. We're also going to have dedicated resource for social care employer engagement and also for resident engagement as well. Yes, I know that some of you have already registered your interest in the academy, but I appreciate it's been a few months since we've discussed this. So if there's anyone else who would like to be involved, then please do email me directly, and I'd love to have a chat with you about it further. So I just wanted to give a bit of an update on where we're at with Proud to Care London and what's been going on over the last year. So Nathan has attended 8 health and social care job fairs this year, and he's engaged with over 90 people and discussed the role of the care sector and what types of jobs are available. And I understand he's had a lot of sort of positive feedback as well, and lots of good engagement from people. We've had 17,000 users access Proud to Care North London website, and we've had a total of 186 jobs as well posted by our employers. So in the next few months, there's going to be some new developments. So there's going to be an offer of care home clinical training, which is a project being run by our colleagues in the Islington Training Hub. There's also going to be some training offers that are available, including self-assessment. And we're currently supporting the work of the Prince's Trust via the website, And also we will be utilising Proud to Care North London for the work to do with the Health and Social Care Academy as well. So the next thing I wanted to have a chat about was international recruitment. I know that in the workforce survey we did during the summer, we had the stats to show that 80% of our providers aren't currently doing international recruitment. However, 20% were. So we're going to discuss it a little bit later on. But if people do have any best practice examples of how it's working for them at the moment, then we'd be really, really keen to hear from you. At the moment, London ADAS have been doing lots of work around international recruitment, and there's due to be some funding from the Department of Health and Social Care. So the total being allocated to London is £1.68 million to support efforts with recruitment from overseas. There haven't been any firm decisions made yet around how this money is used, but it will be split across sub-regions. And London ADAS have asked particularly if there's any examples of how it's worked well for people, but also whether people foresee the challenges or what they foresee the challenges being and how they feel that this funding could be best utilised. And just briefly on student placements, again, we had really good feedback in the survey that I think over 50% of people are keen to be engaged in offering student placements. We have had a couple of meetings earlier this year as a working group, which is something I'm very keen to revive. We have sent out some communication recently about student placements. So again, please do get in touch with me if you would like to be engaged with this. And just one thing to mention is that our colleague in Haringey, Adult Community Learning, has advised that they're currently doing a health and social care course for people whose first language isn't English, and they're looking for placements. So if anybody is keen to host placements, I think she said it will be at the end of January. But yeah, please do let me know and I can put you in touch. So I'm going to hand over to Ronke, who is going to give an update on the Prince's Trust.
Thank you, Naomi. Good afternoon, all. So as you know, we've been enrolled since May of this year. First programme was delivered back at the end of June, and then another one delivered in August. So all in all, we've successfully run 3 out of 4 programmes, with the September one having to be cancelled. Out of those 3 programmes that we've run, I managed to successfully engage 29 young people for participations, and out of that 29, 12 have been offered roles. Let me just confirm that it is 6. No, it's 5 that have started. One will be an additional one in the new year, and we've also got a standalone person that I was supporting as well, taking the offers to 12. These roles are for healthcare support worker roles and maternity support worker role, which is the ad hoc one. The reason why I'm doing the update today is pretty much around the developments that we're looking at for the new year, looking at how we try to support social care in this current year. It hasn't been as successful as healthcare. So speaking of which, I've tried to look at the capacity and where I'm not asking for your time outside of what you've got going on already. I recognise that a lot of providers are using Indeed and other recruitment drives in order to bring people in as a form of recruitment. And I guess my ask is, what are those platforms that you are currently using, and embedding myself into those? For those of you who didn't know how the previous programme ran before, it was a block of a 3-day programme from 10 to 4. Not only was that inconvenient for the young people who were participating on the programmes, it was also not proven very convenient for the employers that we were partnering with. And whereas with this new model, the aim is to embed myself into, for example, if you are working with Indeed, support Indeed with anyone within the 18 to 30 category, because we have development award funding. What that is essentially is that we can support you with funding, well, not support you, but support the young person with funding for the first 1 month before they receive their pay, which is an incentive for them staying on at the job and maintaining their roles. And that doesn't require for the employer to do anything additional to their role, but in anything make the role look more attractive. So we're kicking that off in January. The only additional ask I do have is we were running information sessions. So what that is it's a 1 hour employer Q&A with the young people that we have on program. And then you'll tell them about the role, the salaries, they have the opportunity to ask, for you to discuss any potential other opportunities past their role, career progression pathway and things of the like. In addition to that, there wouldn't be anything else. How you would run your normal recruitment process would be the same. It's just that our candidates would probably highlight in a supporting statement that they are Prince's Trust candidates, so you can recognise that. So the aim, like I say, is for us to just work a bit more efficiently, with us still getting the same outcomes that the healthcare sector are getting. Because unfortunately, what I can say is out of the 12 that we do have, none are for social care. And where young people have been offered roles with social care, they've declined the roles with social care in order to progress with healthcare services. So how can we make that look more attractive and more sustainable? And that's, I guess, why we're going down this pathway. I'm just looking at a comment here. Total Jobs, Indeed, and your own website. Yes. So anyone that is usually using other recruitment drives, it would be nice to loop in with you and see how we can offer, or even if you identify a young person who has applied for your role, not necessarily suitable, we can embed. There could be a line essentially or a paragraph at the end of the rejection letter that states that we can support these young people with employability support, application support, CV writing, so then they can be a successful candidate the next time they come into you. I think that pretty much, do I have another slide after this? No? Naomi? No. I think that pretty much snapshots it as a whole. We are working on others, but this here is the pertinent one that we're trying to implement and see how successful that is in comparison to what we've had going on already. Thank you.
Is that all the workforce updates, Naomi?
Yeah, I've got a slide for a bit later on,
Right.
just about cost of living. But if there are any questions, I'm willing to
Great.
questions.
Adrienne?
Yeah, I'm happy just to, I suppose, a couple of things really, Naomi. They sort of interlink in a way. International development, well, we have been recruiting overseas. We have had quite a few challenges. I have got some people in place, but it's incredibly lengthy and really complicated. Yeah, and so if there was any opportunity to give feedback, one of the other complications is we got ourselves into a tangle because when we were recruiting from the Philippines, there's an extra layer of the having to apply to the Philippines Overseas Labour Office because they have a direct hiring ban because of exploitation, I believe, in the Middle East. And that process is really complicated because it also means that before I can even submit documents, so I've got someone at the moment who's actually got their visa, cannot come to the country at the moment because I haven't been through that process, because the documents also have to be apostilled by the Foreign and Commonwealth Office. And actually, right now, I've been refused to use the premium service to go up in person and get it done. So I'm waiting 20 days to get it apostilled before I can even get it somewhere else. So there are some very practical kind of aspects as well. And there's some odd things in terms of sponsor management visa. So if ever there was a working group, Naomi, that you wanted us to give some feedback to, we would say we have. There's other learning also in that in the ones that we've learnt that, so that in terms of the English language requirements, there's a couple of differentiations. If you've studied your course predominantly in English, you don't have to do the English language test. And we've then found on one occasion we are now sending them to extra English language lessons. It's not quite worked. So that's a bit of a learning as well. But it sort of links to Prince's Trust, and probably in some respects why we are going the international route and not the Prince's Trust type route, in that because of the fact that we've still got such a large number of open vacancies, the thought for us about supporting someone very inexperienced is worrying, and we just don't think we have enough. Once we can get more of our posts properly filled, we feel that we can do more. But I didn't know, so we probably would have got a number of people who might be applying. So if there is this line that you would like us to put in our rejection emails, that would be great to be sent some wording on that. That would be very practical. But in our, when we go through our typical adverts, even in Indeed, it's almost like 80% are applying for overseas through the overseas sponsorship route. And in fact, we have decided right now, because we've got quite a few in the pipeline, that we're going to stop overseas, because I just want to see it settling in and working out how it's going to work, bearing in mind that we've never met these people face to face. We've interviewed them all through Teams and everything. So but it is a conundrum. So I feel sorry to hear about Prince's Trust in a way in health and social care, because I think it's a valuable experience, but I can see where care homes might be worried about, if they bring somebody in, can we really support them and help them. But yeah, if there's any other ways that you think we could still encourage people to, you know, to then be part of a fund where I think probably needs to be a much larger care homes group, where you've got more stability, or maybe in other parts, not quite so much the parts of London which have, I think, probably have the bigger shortages more than anywhere else as well. And my final thing, Naomi, was I think we are really trying to do some work on career pathways, but I think, did you mention that there's a training hub, career pathway hub tool?
Yes, it's in development at the moment, so I don't have an actual timescale for it. But yeah, we can definitely share that with you when we have it, and it will form a really useful part of the academy as well.
Okay, that would be really, really good, because we're still struggling. So we advertise all our jobs internally. We sometimes have people apply and they're not successful, and then what we're wanting to do is have sort of like a sensible development plan for these people. We think we're a bit, we do some things, but it's not consistent and coherent enough. I just did look at all the skills for care materials, but it's, I was going to mention that, yeah, it's good, but it's almost like it's overloaded, and yeah, I think that I need to say what's almost like the most important set of kind of skills that we could help develop someone who perhaps is going from team leader to unit manager, from unit manager to home manager, I think even from senior carer to team leader. So it's our care ones. We really want to do something, but we're stuck. Again, we're not big enough. I know one of the other bigger providers has a head of talent, but we're not quite big enough to do that. But we want to do something. We know that they are our best people, and you know, reading all the skills for care recruitment and retention issues, and all the fact that we're shuffling between the sector, we're better off retaining. But yeah, something that's easy and really has a blended approach. Naomi, I came across this amazing nurse who's been doing a nurse mentoring matching scheme,
sounds good.
matching people across 55 countries or something like that. And I thought, I really wouldn't that be amazing if we could do that in the care sector, where she sort of has it's a kind of amazing database, and then she's matching people who can talk to each other. And I think mentoring, because we tried coaching on play and it didn't work, but I don't know if there was anything in that or anything like that, or thoughts on it. I'd be right for being a part of any working parties, but I think, yeah, retention and how we help really genuinely equip people for future jobs it was definitely the way we'd like to go.
Yeah, and I think also, I wonder whether so we work closely with Skills for Care, who have their workforce development fund as well. So we were actually going to ask Mike from Skills Care to come to the next provider forum to talk about that more and actually give further details about how it can be utilised.
Yeah,
So I don't know
that
if
would be
that's
great
helpful.
actually, because we've
Yeah.
bitten the bullet about the fact that we've actually probably signed up for that. We were just going through all the, because it's the uploaded data in the past that stopped us.
Yeah.
But we've actually decided we're going to try and go for it. I think we still got some gaps in that data, but I think having talked to Skills for Care, they said it will be all right. So yes, we would be
Great.
definitely interested in that. And it certainly, it sits alongside recruitment, doesn't it? It has to sit there so powerfully as well. But yeah, it's this bit, sorry Naomi, but it's this bit about how do you complement it with all the online training? How do you make time for it? How can it be at times bite-sized, but focus on what they really need to make a successful transition? We had one person that was promoted up and then actually didn't quite make it and didn't stay. So that was a learning for us to say we wouldn't want that to happen again. We want to make sure that it really goes well. So anyway, I hope that's helpful.
Very helpful, thank you. And I did have some follow-up questions for you, but I think they'll come up when we do the Slido next. So that's all right. We can.
Any other questions people have on the different workforce areas? So I guess from my perspective, last year was the first time we've seen a reduction in staff levels in social care in terms of headcount. So we know demand keeps going up. We know we need to find ways of recruiting from different places. So personally very keen that we explore the Prince's Trust and the Academy and other options to kind of find ways of supporting new people into the workforce, because it's clear that that's something we need to do as a sector. And I'm sure there's ways of doing that mitigate the risk around health and care from the earlier, you know, the kind of conversation that Ronka had. So any providers that are interested in kind of working with us on some of this, then please get in touch with Naomi or Ronka directly. And so no more hands have gone up. So Naomi, I guess you're going to do your Slido on international recruitment, are you?
Yes, so we've got 3 different questions about international recruitment, Prince's Trust and student placements as well. I think Nathan is going to do his magic and connect us to Slido, hopefully. Ali, I've just seen your question. Yes, we can give you the website address for the Islington Academy.
Yep. Hello everyone. You should be able to see the Slido, and I'm pasting the link in the chat as well.
So the Slido is there. So what do we do then, Nathan, just for people who haven't done it before?
There you go. So I've just opened the first question up. You can scan the QR code, click the link and enter that code, and then you'll be presented with a question. So this would be the first question. And it's all anonymous, so don't worry, you can kind of bear the old truths. And yeah, if you could just possibly answer the question, and we should start seeing the answers kind of come up. Oh, someone's put in the code. So I think maybe, yeah, if you might have put in the code. So you might not need the code if you scanned it with a phone. So yeah, I think we just kind of wait and see.
Yeah, I think some of the conversation that we've just had with Adrian will be really useful in here, and anything that comes up, it would be great if, you know, if people are happy, I'll feed it back as well to London ADA, sorry, I should say. Yeah. Also, just to ask, because the workforce survey that we did in the summer was anonymised, so unfortunately the 20% of people who have done the recruitment and have positive feedback as well, we can't identify. So if there is anybody on the call who was part of that 20%, yeah, we would love to hear from you. Okay, so we've got quite a lot of things coming through. Definitely some themes around the length of time that it takes.
And in terms of the so the funding, if it comes to NCL in the way they're planning, it'd be what was about 280,000, I think.
Yeah, roughly. Adrian.
And are there things, any views on what that might be spent on, Naomi? Just to help people kind of think it through a little
So
bit.
there's a range of different things that it could be used for. So that could include cost of visa applications, any sort of resettlement fees that people would have to pay. I think they're looking at accommodation as well. And I'm trying to think, there was probably a wider list. I think they're keen to know what people feel it would be most useful to have that money used towards. Let me see if I can get up a list. So advice for providers about the code of practice and how to use ethical recruitment agencies as well. And also maybe providing safeguards for employees. And then other ways it could be used, services to book flights and transfer belongings to the UK as well. I think travel to the UK, so help with flights. Onboarding and induction support as well. So things like collecting people from the airport, showing them around the local area, setting up a bank account, registering with GP service, all those type of sort of domestic things that people would need to do.
Naomi, it's just Adrian here, but it would be incredibly helpful because those were all the real practical issues that we were facing.
Yeah.
Definitely things like kind of bank account and all of that, which still went wrong a few times, and we're trying to get them onto payroll as well. We're certainly at the moment, I mean, we agreed to pay towards flights. We did for the first few have some ability to help with a bit of accommodation, but at the moment we don't. So accommodation is a real issue. We are partly saying that we would pay towards a certain amount, but they're desperate really because to know where to be sometimes, especially in London, to be looking and how to be looking and how to be looking at a good price. So, and we just can't do that. We're way too small to help, but those issues are there. And I think it's right where people are putting up about language issues, follow up sort of possibly language skills to make sure when they're here, because like we're using them as senior carers, so we are expecting them, we're allowing them a sort of long time to bed in, but then we're saying, well, we're expecting you to take on a job, and we want them to succeed, but language is probably still, it's almost like they need advanced ESOL courses as well, maybe within a care group, so that they'd be talking about some of the things, not learning about how to go to a restaurant, but learning about how to do things in a care home would be good. But very much. We did try and arrange a taxi for them, then pick them up, but all of that was significant, and even things like food parcels. So yes, any of those things would make a big difference, and especially for, I would have thought, the smaller to more medium providers might mean that we could just about do it really as well. Sorry to keep speaking out loud, but I just thought it might be helpful.
No, that's really helpful. Thank you.
Thanks. We've got a really good list coming together. Ronka, do you want to come in?
Yeah, I just wanted to jump in there. It's a question for Adrienne. I just wanted to ask, if there was support in place for this, how would you measure that before they come into role?
As in, I think
the quality of the candidates, I guess.
Yeah, it's the quality of the candidates, but also it's the worry at my end that we're so busy that they would just be treated like a normal experienced care person, and they would then struggle. And I think we've seen that in the past sometimes, even when we've recruited our own, what we started to recruit unqualified carers, and if we don't feel that we've got enough more senior experienced people on at the time, then it can be difficult. So it's more about us supporting them when they're new to the role.
And the
Maybe-
country, I guess.
and
Yeah.
potentially sometimes the country. But I think maybe in terms of Prince's Trust, maybe the placement is the way that it could work the best, really, because I guess if you're having the placement, then you're getting used to it, and then that could be the opportunity for the home to say after the placement, actually, because they're more used to us, we think this could work. So maybe we might be a bit more adventurous. Does that help at all? Okay.
It does. Thank you. I was just brainstorming with Naomi the other day, and it was something we were discussing, having people in placement and having the program content run side by side. So if they're new starters, they might come and do a morning with me in terms of content training, and then they would have that role where they could actually put it into practice. With the practical stuff side of it, that is something that is embedded in our program, but I'm thinking more of live experience because they're in a different environment, and how that could best be effective whilst learning on the job without you as an organization needing to do more.
Yeah, I think it could. It always depends on how stable your team is in any of the homes at any one time. Like where we've got just a new home manager in, we're thinking, well, her priority's got to be on stabilizing her own team at the moment, hasn't it, as well? So it sometimes kind of depends. But in a stable unit, then I think it really could work, that it's a combined approach, and then maybe then through the fact that the person gets some more real, as you say, a combination of sort of what we call, off work and in work experiences, that they're more have got a realistic view of what it's like, because it is just something that happens to us with quite a lot of unqualified, and we do have sometimes people start and then don't last more than 2 weeks, and they say their role wasn't what we thought, and we thought we've tried to do these competency-based interviews, we've tried to describe it, we've tried to have videos, but somehow there is that gap, isn't there, about how this work particularly is. It is different work and it's demanding work. I do understand that. So
maybe something to explore there. And just in terms of the questions, Naomi, did you have 2 more, did you say? I wonder if we
Yes.
just
Yes.
with time, if we just go on to the
So you should be able to see the second question now.
Thanks, Nathan. So maybe I should have reworded this slightly differently. So I should have put an option in for if it's a no. And I wonder whether anyone would be willing to share the challenges or the barriers that they're facing in terms of not offering student placements. I'm sure there are many. It would just really help us to understand further to sort of what's stopping, what's preventing people from doing it. Okay, this is interesting. Thank you.
think the bit about the home care agency and what a placement looks like in home care is really important.
Yeah. Especially lone working. Okay.
Great. So there's some bits that remind me, what were the next steps on placements, Naomi?
So we're going to revive the working group that we had previously, which also included some of the training providers as well, because there's a few different strands with student placements. So there's volunteering placements, and then we've got student placements from health and social care course students as well, because they all have to spend a certain amount of time on placement as part of their course. And some of the training providers are currently, but they will be working with some of our health and social care employers, but I guess also trying to strengthen the links between the two. And this work will also factor into the work of the academy as well. So just trying to see what the barriers are. And we did have some good discussions before as well, because I know that there are some residential homes who frequently have students on placement, but predominantly they were in activity coordinator roles. So although that's a really good insight into the wider context of the work, it's not necessarily giving the students enough insight into the day-to-day tasks that they might be doing as a carer. So just thinking around how we can try and educate students on what they would actually be doing in the role. And as Adrian said, people often come in, don't fully understand what the role actually entails, which is why there can be quite a quick turnover. So just trying to look at that and see whether we can encourage the providers to maybe enable the students to spend time with a nurse and understand, even if they can't do a direct observation, at least they could perhaps understand the role a little bit more. Equally with a senior carer, sit down with them and just talk through exactly what they do. And I know that time is obviously going to be a big constraint in that. But it's just, I think I'm really keen to work with our providers and see what we can do in order to try and increase the uptake and the offers of student placements and NCL.
Great. So we've got some fantastic comments.
Yeah.
So I think I'm hearing you kind of keen to work with providers on this and engage them in it. So if anyone wants to work with Naomi on it, then either put in the chat or email afterwards. Great. And do you want to move to the last question?
Yep. Thanks, Nathan. I know that we have had some discussion about this already. But yeah, we're just keen to know what people's thoughts are. And as Ronka's already mentioned as well, she'll be adapting some of the work that she's been doing recently in order to try and increase the efficiencies.
So we'll give people about another minute or so on this. We've got 5 responses now, so we're starting to get a decent amount.
The comment in the chat, sorry, is that related to work around student placements or Prince's Trust, or maybe both? It's, I think, eye care recruitment, which I think is Enfield. Both. Okay, that's great. Thank you.
Great. Okay. So hopefully some areas to work on there. We know with the workforce challenges we have, we need to do things differently. So hopefully these are some opportunities to help. And I guess the bit around information is really useful to know. So that's something there to definitely follow up on. Okay. The So the last item is around cost of living guidance, Naomi. Oh, sorry,
Yeah.
Ron, could you want to come in?
Sorry, yes, I've just realised with Slido, it's actually anonymous. So anyone who has put in that they'd like information, I won't be able to pick up who you are. I'm gonna put my email in the chat box. If you can please email me. Sorry, it's silly for us to do a poll and not know who wants the information. But if you could just drop me a line, I'd much appreciate that.
Great, thanks, Ronka. And you know, I think probably a sort of general message that we can keep getting it out through other channels as well and through boroughs. Great. So on the cost of living guidance, apologies, I've had some unexpected leave this week, so I'm slightly behind. Naomi, was the paper sent out that has information about cost of living support in each borough?
No, but it can be after this. The update, it's a really, really brief update, just effectively signposting people. But yeah, Dan does also have the paper. I just think it needs some slight tweaking before we send it out.
Okay. So is there an
So I can just sorry. This is what I've put together for the purpose of today. So it's just really to let people know that this work is being completed at the moment across the 5 boroughs. There's been a lot of thought about the impact of the cost of living crisis on our residents. Keeping Well NCL Hub have done some work as well, and I've put a link in here for a financial wellbeing webinar. But in addition to that, each of the boroughs have their own resources for supporting people in the boroughs. So we will share this afterwards, and all the links on there will be live, and they'll go straight through to each of the websites for the councils. So yeah, as I say, just a very brief update.
Okay, so if every borough has put quite a lot of work and money into support, what I would say is every borough doesn't have enough money. So it isn't as widely as available as they'd wish, but it is there to support those people who are particularly at risk. And I guess I was thinking of it from a couple of angles. So there may be staff that are really struggling, that have wider costs, who want to kind of look and access support anyway. As Naomi says, there may also be the kind of support around how to deal and or you know, techniques to help people deal with things through the NCL Wellbeing Hub. But also, I suppose I was thinking there's also people that you support that you might be aware, for example, not using heating, and that where that could worsen their condition, stresses around debts, those sorts of things. So again, well, the links are there for residents to access and use themselves, but we know a lot of the people who you support are very vulnerable and won't do that. So it can be shared with your staff team to, you know, advise, signpost, help people access as well. So that's what we were kind of thinking, but we'll share the information so people can follow up, and you know, we know this is going to be one of the it feels like we say it annually now, but one of the toughest winters we've ever experienced. And you know, it was COVID a couple of years ago and last year that we were really focused on, whereas this time it is cost of living, especially, and as always, all the pressure across different parts of the health and social care system. So just really wanted to flag it and kind of encourage people to use it. And I'm sure you're doing lots already. And that was going to be it. But if anybody wanted to kind of comment on kind of how sort of staff well-being or support, then do. In that case, we have an AOB, don't we? So it's AOB for anyone, of course. So if you have other things you want to raise, then do. But Mui, you had one around the digital work.
Yes, afternoon all. I'll try and make it very quick. For those who don't know me, I am Wee Adekoya, and I am the NCL Care Homes Programme Lead. And I thought I'd just do a bit of a plug. I don't know if anyone, if there's a show of hands or if anyone can let us know. How many of you have received the survey for the Digital Maturity Index, maturity survey that we've sent out? Okay. I know we all can't talk at once, but I'm hoping that some of you have seen it. And if you haven't, I'm just going to do a quick plug about it. So as you know, over the last 18 months, we've been working predominantly in the care home sector, rolling out tools like remote monitoring, and we're just about to roll out acoustic technology. Fortunately, we've been given some funding by NHSE to actually roll out a wider programme of work around digital social care records. And as part of our trying to kick off that piece of work, we asked our council colleagues, all our leads, to actually send out a survey to both the care home providers and also to domiciliary care providers. And it's just, it shouldn't take more than about 10 minutes at most. And it's called a digital maturity survey. And it's just us wanting to find out what you have in place. And if you want to procure a digital care record, what it would be or what and how we can support you. So it's a short survey, shouldn't take long. If you do have it, please fill it in. And if you have filled it in, thank you. Richard, I think I'm done. And if there are any questions, I'm happy to take them too.
Fantastic. And I can see we've got, so if any questions on the survey, we've got some people's emails in the chat, which I assume, Naomi and Ronka, why don't you just sort of do a general follow-up email to check what people are interested in, and to kind of keep putting the offer out there, because we know how busy everyone is. Nathan, do you have a question?
Yeah, it's just a quick, well, not straw poll, but I'm just curious. So yeah, wonderful that you're all here, and I know you guys are all busy, but I was just curious about the forms of communication that we have with you guys, the providers, and I was just wondering what is the easiest way to like have communication with you? Is it over Teams, or would you guys prefer Zoom? Not saying that this is the the end of poll, but just kind of hearing it, what you think. Is Teams working for you? Do you use Zoom more? Yeah, is anyone willing to speak up on that?
Or put it in the chat, although I guess if people are struggling with Teams, they probably aren't here. So that's
that's a good point.
But yeah, it's one to ask wider people though as well, Nathan. Like people are comfortable.
Yeah, Teams here. Yeah, it's something like I said, I'll keep an eye out for a bulletin, because maybe I'll do a quick straw poll in there. But yeah, I thought while I have you, it's the end of the year. Yeah, thank you, everyone.
I guess my only other ask on that would be that we keep promoting through borough forums around these events. Nathan, one for you to pick up. But if providers, if you're at, do kind of share with other providers to come along to these as well, because we pick up things that are kind of NCR wide that locally you're less likely to hear about, and we just love to get to more people really and make sure everyone kind of has the opportunities. But I guess that's a good place for us to end. Thanks everyone for your participation today. We'll get some meetings, and I don't think we've got the next ones in yet, have we, for next year?
Yet. They're coming very soon.
Yeah, should be done shortly.
Yeah, so we'll get those sorted for invites for next year. And yeah, noted on the reminders. We do always try, but also recognise 10 days before Christmas, with the pressure people are under, can be an issue. So thanks a lot. Have a lovely Christmas and New Year, and we'll all support each other, and kind of, for those who are working, support each other and get through it, and for those who are off, have a great time, and you will have earned it. So goodbye.
Right. Thanks everyone.
Thank you.
Bye.
Bye.
Bye. Thank you. Bye.